Now, let's take a look at a study. This is one of our earlier studies, and it basically did an integrated treatment plan of what we're going to be talking about today. And what the study showed, 91% of people with a CFS and fibromyalgia had moderate to marked improvement in their symptoms. 91%. This is a very, very treatable disease. So let's take a look at the study. Titled Effective Treatment for CFS and Fibromyalgia, Placebo-Controlled Study. It was basically classic randomized double-blind placebo-controlled intent to treat analysis. For the outcome measures, I still remember I was at an NIH conference in the early 90s, and it was on chronic fatigue syndrome. And they brought together experts, each of which went on stage and said, I have no idea why I'm here. I don't even know what chronic fatigue syndrome is. And the conclusion of the study, of the conference, was there's no way to tell if people are getting better, so we can't do any research on chronic fatigue syndrome. I wanted to grab them by the neck and say, ask them. So one of the 4 outcome measures in our study was we asked people, how are you feeling? Much better, better, same, worse, much worse. And what you'll see, 16 of the 32 people in the active group rated themselves as much better, as opposed to 3 in the placebo group, 13 better but not cured. So 29 out of 32 better. If you're looking at the visual analog scale, the average increase in quality of life was 75% average at the end of 3 months, going up to 90% at 2 years follow-up. Many of you have seen that to give people something, they get a bit better, but now you've stressed one system and the other systems start to crash. So they feel better for a couple of weeks and they crash and burn. So we did the 2-year follow-up study. People continue to get better and better. So this is a good long-term effective treatment. So we have a double-blind study showing that effective treatment is now available for CFS and fibromyalgia.